Да. Да, вас слышат.
So, okay. So we
Колонка.
hello. Okay. Okay. So we have a first patient here. So he's very young, and he has post-acne scars, also some active acne, which they're going also to fade after the treatment, because the chemical peel will also give them that result, so not only on scars but also acne. So the first thing we're going to do is we're going to disinfect a little bit with non-alcoholic disinfectant such as chlorhexidine. You know, we don't need to rub too much because it can interfere with chemical peel. So we're going just to do on the place where we are going to treat with a sandpaper just in case. Although a chemical peel is a very, very strong disinfectant, so it's going to be rather clear after the chemical peel. So, little dry one. Okay. So, a pen. The first thing we are going to do is mark a treatment area, and this is the area where we are going to treat with the sandpaper, and the other parts we are going to treat with the chemical peels. Since we are using abrasive protocol, so we are not going to use easy TCA pain control. Otherwise, when I do any other treatment that does not include microneedling or abrasive protocol, I only use easy TCA because it's more comfortable, and not just that, it's also more effective, about 20%. But in this area, we are going to use an easy TCA. The first thing we are going to do is to prepare our sandpaper. I need the block. Yes. No, just the block. Okay. Let me use something that we have it in the set. So it's going to be this easy TCA activator. This is very handy. We're going to cut the sandpaper on the length of this bottle. And just put it like this, and it's that. So we can start with this, and we just do a little with our hands. We will just hold the skin like this, so it's going to be easier for us to do. So we do it really slightly, left, right, and we continue doing that till we see the difference, and we can now see that what I've talked to you about, the keratinocyte touch. Here, my finger slides very easily, but here, see, it stucks. That's why we have here, we removed a topmost layer of the skin. We're going to do also the same thing on the whole area that we marked, and since it doesn't have that much of scars, like you saw the patient on my picture, and also we don't have so many time, so I'm not going to use a two-step protocol that I showed you. So we have a different, let's say, protocols. It's a one-step protocol that I'm going to show you. So you just abrade the skin and apply a chemical peel. And you have another two-step protocol that you saw on my slides. You abrade the skin, then you put anesthetic, and after you've had enough anesthesia on the site, you would then apply more chemical peel. With that, you get much deeper peel. But you know, he is very young, and let's say that he doesn't need such a deep peel. Let's say for also, we need to change a sandpaper regularly, because while we do it, it's going to lose its ability to abrade the skin. And you should probably see that. I need that. I need that. I need the other one. This one is not good. No, the other sandpaper. Sandpaper. The one before. Да. Boli, ja? Boli? Ne? Okay. Okay. Since you already have some points of blood, we're going to start here and go to a different side and do exactly the same treatment. I know that for you, looking at this is going to be okay, we saw that, but you know, I have to do it because unlike, let's say, fillers yesterday, they can be done, you know, on one side and then done on the other side. This is kind of quirky. We need to do it at one moment, because you'll see how I apply a chemical peel after that. And as more you abrade, you will actually have a better result, but don't overdo it on the first treatment, because then you risk of a patient not showing again. And actually, the younger the patients, especially when they're teenagers, you know, their social life is very, it means a lot to them. So, you know, if you're doing it on them, you have to be very careful that they are going to show again, because you'll get an extraordinary effect with only one chemical peel. But usually only one chemical peel is not enough. So you need to do it more, and you have definitely need a compliance with the patient. now we see here blood, and that's where we usually stop. Give me a little gauze. Gauze doesn't. Oh. This is where we stop with the abrasion, and then we prepare a chemical peel. Can you zoom here? You see here that you don't have to remember everything by heart. So every time you have a box, you have the explanation of how to do it. If you have the time, it's also rather good to read all those papers here. They are presented, because here you will have all the information you need about the chemical peel and most of the answers on the questions for your patients that can arise after the treatment. So how you prepare this chemical peel? There are different sets. This is the starter set, which actually has 4 to 8 treatment, can have 4 to 8 treatments in the itself. So at least 4 to 8 patients you can do with this set. There are other bigger, and also sometimes the packages can differ. You can sometimes have this base solution in a ampulla like this, or you can have it in a flacon like this. But anyway, please do read what you put inside, because I saw doctors that they changed those flacons because they look rather alike, and then they had definitely some complications, as a huge redness, which actually they didn't have any definite problem, but a bit of a longer transient redness. So the first thing you're going to do is take this base solution. So you need 2 milliliters of this base solution, and you put it in this container. When you do this, you're going to put that substance that differs easy TCA from another TCA peels, because in this base solution you have the substances that will make your chemical peel safe and secure for you and your patients. Then when you take this activator, you will probably get these gum on the top of the flacon, probably a little over it. So the one thing you have to do is put it away from yourself, because when you punch it, a little bit of acid can go out. So you just take a little bit of air, and then take out 0.75 milliliters. So don't use big syringes, because you never know how much you took. 2 is rather bigger, but it can do quite a good job. But I always use 1 milliliter, but this can also help. So once again, 2 milliliters of the base solution and 1 milliliter of the 0.75 milliliters of the Easy TCA activator. You have to prepare, once again, those things that you're going to need after, and one of them is post-peel mask. A post-peel mask, as I told you, is not a neutralizer, because TCA peel does not need to be neutralized. But this is anti-inflammatory blocker, also a protection. It has a lot of antioxidants in it, and also a sun protection. So your patient is quite secure going out of your office. then you need to look at what you're going to do on a face or a body. And since we're going to do a face, we need 2 grams of this post-peel mask. On the other side of this paper, you will see those lines, and every line represents a 0.5 grams of this mask. And since we're going to do a face, we're going to need 2 grams, and 2 grams are 4 lines of this product. And we just prepared it before a chemical peel, and we are going to need it at one point of time. Also, what we are going to need also is that yellow powder I talked about. It's bismuth subgala that you actually have it in your sand abrasion kit. It's yellow and it's powder, and we'll just put it on a place that we can use it when needed. So you would ask, is there any fancy way of applying this chemical peel? I would say, no, it's not a fancy way. You just use 2 cotton buds. You use 2 because if you have 1, and if you apply, it's going to, just deform. But when you use this, it's not going to deform as easily. Why you use these plastic buds? Because for one, if you use wooden, the wood would soak off a little bit of chemical peel, and it also does not have the elasticity of this. So because we need this, one other thing that I'm going to insist on, when you put these cotton buds inside, first you mix a little bit. So as James Bond 007 would say, shaken, not stirred, or the other way around. So we are going to stir it, not shake. And the next thing is, if you just take it like this, those drops can drop on that patient, and that's not something that we want. So what we're going to use, we're going to slide 1 to 3 times around the walls of this container. And how much you should use? Well, if you have a thick skin like his, you should probably do only 2 rounds. But if you have somebody with less thick, meaning thin skin, you're going to do 3 times. So for him, it's only soak in and 2 times, and we're ready to go. So if you can focus on his face, the first thing we are going to use is on a location that we already did. So it stings a little bit, but you see right away that we have a frosting, mostly on the place where I started first doing it, and we're going to do the same thing on the other part. So after we have a frosting, should be at least frosting clouds or full frosting, which we do. It's just a little bit different. Can I have a go? So to tell you the truth, when you have male patient, they will always cry. So no matter what you do to them, let's say injection into the scalp for a hair rejuvenation, or doing something on the face, they will cry. Unlike women are really motivated. So what we see here, we have really a frosting that we really want. Now what we want to do is cover a whole face with a chemical peel. because when we cover this whole face with a chemical peel, we are going to lose this demarcation line that we would otherwise have if we wouldn't do that. I would usually start with the head and with these round circles. You would cover a whole area that you marked. As you can see, hopefully you can see, this pen that I marked the area is easily wiped out because in this chemical peel you have a makeup remover that it is really easy to use. So you usually don't need a disinfection before the treatment. And also if somebody has a slight makeup, you can, yes, you can do it. You can remove it with this. But if somebody comes to you with tons of makeup, then I should probably use Skin Tech cleanser. And before this, you don't use nor acetone or alcoholic for this treatment because it can interfere with the depth of your chemical peel. This is the next area, and we're going also to cover once again the area that we abraded. With this chemical peel, it's really easy to go all the way about 1 millimeter from the eyelid, from the eyelashes, because it won't drop, and we will have the great rejuvenation of the whole head. So we just do the whole face. For upper lips, I cannot go in circular movements, but in other, I should probably. And we apply and still apply. Then the eyes. And please, if I forget the nose, which sometimes I do, please tell me. No, I won't. So you also cover the nose for a full rejuvenation. Not just only rejuvenation. He definitely needs, he has acne, he has pimples, so this will help. And just go a little bit about 1 centimeter down the mandibular line to cover this. So we check if everything is dry. If it is, I would definitely like to apply one more coat. And now we apply with only one moistening a whole area of the forehead, and the same thing to the cheeks. Okay, now we will stop, and the pain for him will stop. When we apply a post-peel mask, it takes about 2 minutes before the pain goes away. So we should apply this first on the area that we abraded, and then on the other parts of the area. So, the other parts of the area we do treat because we don't want a demarcation line. And second, it's good for the rejuvenation. And when we do this, we then ask the patient if there are some places on his skin that are really painful and tender. Где боли? Где? Равномерно или не равномерно? Okay, since the pain is rather fading away, this is where we are sure that we applied a post-pill mask greatly. And now we need bismuth subgalate. Bismuth subgalate we will apply on the place where we did abrasion. And now it's a tricky part. And I'm sorry, but I will put a little bit, him a little bit down, so it won't go all the way. And you can see how to do this, and it's always a spatula. Give me two. I prefer, as you saw me this morning, I prefer to combine things. And when I also combine the leftovers. So when I do easy hydroxy peel, for those who do use it, know that they have a spatula in it. And that spatula is an excellent way to apply this bismuth subgalate on the skin as uniformly as you can. So it's good, but for those who don't have it, then those two Q buds or cotton buds are just nice way to apply, because if you have one, you don't have the space, to hold this bismuth subgalate. And what you also do is give instruction to the patient. If he sleeps rather tonight on his face, which he shouldn't, and takes off the bismuth subgalate, he would need to go to come again to your practice, and you will need to put it again. But some patients, live across the country, some other towns, and for them I would give them this bag of bismuth subgalate to take them with them and give them the instruction how they will apply. So when they come again for a control, they will just return me the bag, so they will not have to come to the clinic only for a touch-up on this bismuth subgalate. Unfortunately, putting bismuth subgalate on the face is a dirty job, but somebody has to do it. And when they see the results that you promised them, they will just forget what they had to suffer during and after the treatment. So this treatment is done. What you need also to do is to give them some creams. The one cream that they all need the most is Melablock 50 plus, which will protect them from the sun. Another one is for him, because he has acne, is purifying cream, which is a disinfectant that you're going to use after the treatment and between also the treatment, and after they stop and we finish treatments that we are planned, they should use Purine Gel, which is another cream that is good for his acne scars. Again, if they have enough money to spend, they can also use a nutritive cream, which is actually really good because it will help regenerate them rather quickly. So after the treatment, you will tell them not to wash their face until this falls off. And after 3 days, they will apply the Vaseline on the borderlines of this. And after that, if that doesn't fall off, which will help this crust to fall off, they will apply Vaseline all over. And then when it goes down, you will see a great result after this only one treatment. You usually need at least 3 to 4 treatments to have an excellent result. So thank you a lot. Спасибо большое. And you're alive.
Уважаемые коллеги, если у кого-то есть вопросы, пожалуйста, задавайте их, передавайте в письменной форме. Мы с удовольствием зададим Нинаду все вопросы. У него будет еще одна модель в конце, поэтому, пожалуйста, обращайтесь. Сейчас после Нинада Станковича будет выступать и показывать свою модель Евгения Ранева. Она как раз продемонстрирует эти авторские техники Slim Face. После Евгении Раневой будет очень интересная модель у Александра Васильевича Бородько. Сочетанное одномоментное применение филлера гиалуроновой кислоты и Easy Fan Light, того самого легкого фенового пилинга, о котором мы говорили. Кстати, забегая вперед, вот уже открою тайну, что будет еще Easy Fan Very Light. Мы вот ждем его очень сильно. Обещала Евгения, что уже в Праге на конгрессе, который будет 10 ноября, они будут его презентовать. Так что скоро будет и у нас. Это также гибридный фильм. И как раз это та возможность, когда у косметолога появляется реальная возможность спокойно, безопасно работать с вином и получать очень хороший результат по омолаживающим процедурам кожи. Еще раз напоминаю вам о банкетах. Среди тех, кто уже сдали, первые 50 милоблоков уже разыграли. Я просто сразу предупреждаю. У нас еще осталось 50, поэтому следующий розыгрыш, если кто-то еще хочет досдать, еще есть у кого-то анкеты, досдавайте. Как только Нина покажет свою последнюю модель, мы просто зачитаем список. Все выигравшие, услышавшие свою фамилию, подойдут в конец зала, на столе будет стоять милоблок и по списку получат. И также будет разыграно 3 корзины ваших подарков, поэтому, пожалуйста, не расходитесь. Спасибо. Алло, Нинад, есть один вопрос, если можно. Как доктор Станкович стерилизует бумагу или где он берет ее стерильную? Нинад?
Берет ее в скинтеке.
Вы
можете нас включить уже.
Да. Он берет ее. Я думаю, Нинад сейчас подойдет сюда к нам. Да, пожалуйста, можно в письменной форме? Да, если можно.
Да, я понял, да.
Ну да.
Следующего спикера слышно?
Да.
Все хорошо?
Все хорошо?
Все нормально?
Нам нужно все 30 будет. Селесок, сангоний.
Пусть послушай.
Ну все, мы готовы.
Мы готовы. Нормально? Пусть выводят.
Мы готовы. Давайте как вот вам так сядьте чуть повыше, как вам будет удобно. Мы готовы. Сколько набирается? Так, ну выбираю, давай отдельно. Следующий.
Евгения, скажите, а Нинад у вас еще остался?
Нет, у нас нет, берет он эту замечательную абразивную бумагу.